My name is Nick Aldrich, and this is my project about maple syrup urine disease. Maple syrup urine disease is an inherited genetic disorder in which the body is unable to process certain protein building blocks or amino acids properly. The condition gets its name from the distinctive sweet odor of affected infants' urine and is also characterized by poor feeding, vomiting, a lack of energy, and some developmental delay. If untreated, maple syrup urine disease can lead to seizures, coma, and even death. Identifying maple syrup urine disease at birth is important to the properly treating it. In the U.S., all infants are tested for MSUD at birth. MSUD occurs in 1 in 185,000 people, making it incredibly rare. The chromosomes that are affected by the MSUD are 1, 6, and 19. It is an autosomal recessive disease. The proteins in the person's body are broken down into individual amino acids. 3 of these amino acids are leucine, isoleucine, and valine. Normally, the BCKD complex in a person's body breaks down these 3 amino acids. Unfortunately for people with MSUD, they have a defective BCKD complex, so leucine, isoleucine, and valine build up. Identifying if a person has MSUD is crucial to preventing long-term damage. Genetic testing is used to confirm if a person possesses one of the malformed genes that causes the disease. It cannot be tested for before birth. If an infant is diagnosed with MSUD, prompt medical treatment can avoid serious medical injury or mental retardation. The initial treatment involves reducing the level of BCAAs in the baby's blood. A child with MSUD needs to create a long-term treatment plan with a physician, a metabolic specialist, and a dietitian. Things to be done for a kid with MSUD. This is a list of things that should be done. The infant will use a MSUD medical formula, which contains nutrients the infant needs. The child's diet must be monitored to regulate their intake of BCAAs. The child will eventually learn to take care of their own dietary needs, and a physician will monitor the child's amino acid levels with regular blood tests. Overall, people living with MSUD do not have it much more different than your average person. And now, on to the Punnett squares and my pedigree chart. Okay. The pedigree chart is right here. It's I'll back up a bit. Okay, now to go over what all this means. Okay, if it's a circle, that means that it's an unaffected female in this family tree or pedigree chart. If it's a square, just a blank square, it's an unaffected male. If it's half red circle, then it's a female carrier, which is someone who has a gene that carries MSUD, but the MSUD is not triggered in them, so they don't actually have the disease. And then for half blue, that means that it's a male carrier. And then if it's a full red circle, that means that it's a female who has MSUD, or a malformed gene in their body that gives them MSUD. And if it's a blue square, then the male has MSUD. Alright, let's look at this. So as you can see, the father of this great giant family has MSUD, so obviously sometimes it will pass on to his kids, sometimes it won't. Like for example, this one right here, that is a girl who has MSUD, and this is his son, and his son is just a carrier. It doesn't have the disease, but he could pass it on to his son if he had a son, which he doesn't. And as for this daughter, she also has MSUD, so when she marries a person without MSUD. And then when they have kids, there's a carrier, and then there's a kid with MSUD. Now for the other side, there's another girl with MSUD, and she is the, I guess, grandmother it would be? Yeah, grandmother of this family tree. And then they have a kid that has MSUD, and a carrier, and another kid that has MSUD. And then that kid that has MSUD has a son that has MSUD, with her husband that doesn't have MSUD. Now as for this guy, he gets married to a girl who doesn't have MSUD, but he has a kid that has MSUD, a carrier for MSUD, and another kid that has MSUD. Okay, on to the Punnett square. This helps determine what the person has and if they have it. So the way that it is done is whenever you're born, your sperm or egg cells have one of these letters in it, not two. So they would have a big M and a little m. And just for the purpose of this pedigree chart, let's say the person in this example has one big M and one little m, and then his or her husband also has one M and one little m. So that means that this square, since it's an M and M, it's going to be two big M's. And then this square, since it's a big M and a little m, it would be a big M and a little m. For this square, it's a little m and a big M. And since, like, the big M comes first, you have to arrange them in order of how big they are. Since this big M comes first, it's basically the same thing as this one. And just because this one's the little m and this one's also the little m, it's two little m's. So what does this mean? This means that this can mean one of three things. If it's two big m's, that means they're a normal kid because the trait is recessive, so that makes it tiny m's. So they're normal. There's a 25% chance, if your parents are like this, that you'll be normal. Now, there's a 50% chance that you could become a carrier because that's a big M and a little m together. And there's two of those, so that makes it a 50% chance. And now if you're unlucky, you can have two little m's, and there's a 25% chance of that happening, which means you could become infected with MSUD, and nobody wants that. Thank you very much for watching my presentation. Goodbye, class.